Hello, Senior Stoner fans. It's the real Senior Stoner back at you for your Puffco, Cupsy, and Hunibadger Diamond Dab of the Day. It's going to be a big hit today. I need a big one. Thanks for joining me as always. When you enjoy today's video, you know what to do. Hit the subscribe button, send a like, and I reply to all the comments. Unfortunately, we're going to get started with a topic that I'm dealing with right now. But it's a topic that a lot of people don't talk about, but need to understand. Irritable bowel syndrome. I have IBS, and I have had a terrible flare-up over the last couple weeks. Last week was to the mat. And living with IBS can be extremely stressful, painful, and the condition can affect your life. It can stop it cold. But people with IBS can use certain strategies to reduce some of the uncomfortable symptoms, possibly even to help themselves psychologically, interventions, and there are ways that we can push forward because you don't want your life to stop because you have IBS, which is a silent, invisible disease. Well, let's first talk about what it is. It's a gastroenterological dysfunctional order. Causes abdominal discomfort, gas, and frankly, changes in the patterns of your bowel movements. You're going to either have diarrhea or constipation or both. So it interferes with what we call the gut-brain interaction. It changes it, and it's dangerous. The dysfunction can increase your bowel sensitivity to everything and increase the spasms and contractions. That can cause incredible abdominal pain. I'll say it again. Incredible abdominal pain. Alien is coming through. I kid you not. You know I understand pain. This one may be one of the worst. I break teeth because I grind so hard because it's so tough. So these symptoms, you go get a CAT scan, you go get an MRI, are invisible. You look fine. You think you're dying. You think you've got the big C. You think everything has happened. You go in, there's no damage, you look fine, they tell you you have IBS. I've been convinced after 55 or 60 years with this, that, and my sister had this, that it's a catcher's mitt. IBS is a catcher's mitt, unfortunately, for doctors that just don't know what you got. But there are things that play a factor, I think, and medicine thinks so too, in causing IBS. Think about this one. You've had a stressful or traumatic early life, early childhood. Have you been physically abused? Have you been sexually abused? Guess what? You're going to have IBS. Raise your hand if you do, and raise your hand twice if that's the reason. You could have mental health disorders such as depression or anxiety, which could give it to you. A bacterial infection. Food intolerances or sensitivities. The treatment, there's not much treatment out there, is dietary adjustments, mental health therapy, and medicine. I read about it all the time. My sister, God rest her soul, was a very early pioneer in social media communication regarding IBS. The triggers, the things that get you into a position where you're in bed crunching your teeth, you might not even know. You might have forgotten. You might be going along your day and just having a normal dinner and all of a sudden, boom. So you've got to find a way to keep what I would call a food diary of what triggers your attacks. Forget what they say in the books. Everyone individually should track the foods they eat and the symptoms they cause. Also, how much stress is associated when there's an attack, how much sleep they're getting. Because a lot of those factors contribute to how difficult and how bad your IBS attacks are. A symptom diary, let's call it. Also, doctors have found that it's important to consider yourself a gluten-free environment. You also, if you suspect you have IBS and certain foods are triggering it, you want to go and you want to make sure there's enough fiber in your diet and you have what's called a low FODMAP diet. Low FODMAP diet simply means that there are certain things that could be triggers. They could be triggers for you. And that will keep the trigger foods off your plate. A person with IBS, as recommended by a doctor, should have a low FODMAP diet for a few weeks and just test and see if it works. That way you can determine with yourself or a dietitian what foods need to be eliminated or even slowly reintroduced so you can have an acceptable level of tolerance. Now, you want to walk, you want to stretch, you want to do as much physical activity as you can, because the contractions in your abdomen and your intestines, as they happen, are going to increase stress and reduce your mobility. You want to improve your mobility and reduce stress. So exercise. Do the best you can. I've got a back situation that doesn't let up, but I can make it to the end of the block. I push to do that. Try. Physical and psychological stressors are a major problem. Life changes, disturbances in your emotional environment. These are all ways that the brain interacts with the bowel and causes pain. An emotional experience, for example. So you want to prevent that by having relaxation techniques, mindfulness, stress reduction techniques, any of the things that we know work to keep us calmer will help us reduce our pain from IBS. Whether you want to do it yourself with meditation and mindfulness or get some type of counseling and support, totally up to you. Yes, there are some IBS medicines. Go see a doctor, talk to them, see what they recommend. Unfortunately, they are not going to stop your problem. I know. I live it. Here's the challenge. Probiotics, medication, counseling, exercise, mindfulness, meditation, they're all ways to help you quell the beast. The beast ain't going away. Unfortunately, you got it, it's a lifelong problem. But there are well-known therapies that can minimize the problem. You can go into what's called cognitive behavioral therapy and try to identify what stress responses are causing this pain. And if that happens, you can tap down on the stress responses so the pain might go down as well. If you've triggered yourself by eating something you shouldn't, well, unfortunately, you're already into the situation. There are new ways that they're talking about treating IBS. Hypnotherapy. I'm not kidding. Hypnotize your bowel. Well, guess what? There's nothing wrong with trying that. But IBS, irritable bowel system, can be really painful. And I think we have to understand what we do when it gets to the point where you're crying, to the point where you're screaming at your wife saying, it's end, it's over, I'm done. When all it might be is gas. Our brains might perceive even a small amount of naturally occurring gas in our intestine as pain. And over time, the brain becomes more and more sensitive to those pain signals from the digestive tract. And guess what? Every time it happens, it becomes worse, not better. Worse, not better. Worse, not better. The triggers we talked about, foods, stress. To me, it's a change of temperature. When the temperature gets to be about 50, 60 degrees outside, there's a breeze in the air, and you get the goosebumps, that's going down here right away, and it can trigger. Well, when do you see the doctor? If you have an unexplained weight loss, see the doctor immediately. If there's blood, see the doctor. Fever, vomiting, continuous diarrhea, see the doctor. The bottom line is that unfortunately, it's a common GI disorder, IBS. People experience the pain ranging from mild to severe to incredible. It's triggered by activities in certain foods, but guess what? Whether it's from constipation or bloating, it can also be hypersensitivity your nerves now have in the digestive tract. It's real, but guess what? You're going to look normal in all your labs and tests. So it's here as well as here. So understanding this, there's no cure for IBS, but understanding this can help you understand what you're going through. You see, a lot of times People do better when they have information at their fingertips. Not knowing is terrible. So let's all understand and take a grip on this. Irritable bowel syndrome, you can't cure it. You're going to live with it the rest of your life, most likely. But you can live with it. I have for 55 years. My sister lived with it all her life till she passed away. Here's what we need to think about. Watch what you eat, watch what you think, and watch what you do. If we can put our arms around that, that will help this. Worrying about this individually, oh my God, every pain, oh God, it's over here now, oh my God, it's up here now, because it moves. Driving yourself insane. You'll drive yourself batty. Don't do it. Try not to. Try to understand that you know it's bad, that there's nothing we can do for it, and that the best thing you can do for it is just try to watch what you eat, be careful of the triggers, and keep your stress to a minimum. Exercise if you can, and understand that 22% of Americans have IBS. That's right. 22% of Americans have IBS. And guess what? 22% of Americans aren't passing away right away. 22% of Americans aren't breaking their teeth all at once. So you might have, like I have, a worse case of it. Regardless of the extent of how bad your IBS is, you can make it a little bit better. Just a little bit. We've talked about this type of work before. You cannot attack the situation by saying, I'm going to stop my IBS today. Not going to happen. You can say, I understand my IBS a little bit better, and I'm going to pay attention to it and try to minimize my pain and suffering. That's the best we can do. This has been The Real Senior Stoner. You know what to do. Since I expect you enjoyed this video, hit that subscribe button, send me some likes, and I reply to all the comments. Here we go on a heavy hit on our new Hunibadger with our Cupsy. Here we go. Cheers, everyone. Have a wonderful day. And remember, you can minimize the pain associated with your IBS. Cheers. Here we go. Ooh. Ooh, gotta watch that tip of the Hunibadger. It doesn't burn your hair, your forehead, or your hat. Thanks for joining The Real Senior Stoner, everyone. Have a wonderful day. And remember, most important out of this discussion, you're not alone. 18 to 22% of Americans have IBS. You're not alone. You're going to make it through, and we're going to find ways to minimize the pain. Cheers, everyone, and have a wonderful day. It's been The Real Senior Stoner. Cheers.